IPL or laser for skin tightening? I need help. I have a hard time trusting a doctor in my area. What is the best treatment for tight, low pores skin treatment? I do have mild discoloration, but if I had a choice, I'd want tight, poreless skin and deep wrinkles gone. Is there hope? I use Tazarac and it's helpful and worse. Should I keep using? Pores seem bigger. I want porcelain skin. Any advice for vast improvements? I want tight skin. By the way, I'm 39, white, light freckles, blue eyes. It's not saggy, but tightness is priority. Thank you.
Thank you for your question. You've submitted a question without a photo, but your description is certainly very helpful. You describe yourself as being 39, you have some light freckles, some discoloration, you're using Tazarac. It seems that your focus is on the large pores, and you state you're having difficulty trusting doctors in your area. And you're asking about IPL versus laser therapy. And what you want is tight skin. You want the pores to look better, and you want the deep wrinkles to look better. And you're 39 again, you're Caucasian with blue eyes. Well, I can give you some guidance as to how we make assessments with our patients about the best option for them for a result that is very much in line with what you're looking for. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years, and I have been using lasers and the latest non-surgical devices since the mid-90s, starting with the original CO2 lasers, which were fully ablative and very aggressive. So I think that what your goal ultimately is, it's not necessarily tight skin, but smooth skin. What I help my patients try to understand is they often feel like their skin needs to be tight, and they'll pull their skin. And whether they need a facelift or whether they want something to make their skin tighter, they feel like pulling may be the ideal, but ultimately having improvement of skin pores and wrinkles is essentially what everybody wants. Now the challenge is, of course, how do we do that in the modern world, but at the same time not have a prolonged downtime? Well, first of all, a proper skin assessment has to be done with a good physical examination, plus the context of medical history. Now you have to ask, we have to understand, how deep are those wrinkles? You may feel they're deep, but they may be, from a medical perspective, not so deep. In terms of pores, you can be sure that most doctors are hesitant to guarantee significant improvement in pores because of just the nature of some people's skin having large pores. Now, I'll go with the most aggressive, which is probably the most effective, but may not be something that you can tolerate with time and the healing process. The most aggressive would be something like a fully ablative CO2 laser. Why? Because you're ablating the top layer of skin, going down to the level where the pores will be almost flush and smooth. You'll get generation of thermal energy, which will cause tightening of the skin, and you'll have a new layer of skin that will look smoother. What's the downside? Well, the downside is it takes a long time to heal. And based on that prolonged healing process, the technologies advance to try to balance. And so with that thought in mind, we have fractionated technology. Now, fractionated technology can be anything from the most superficial fractional erbium laser to a much deeper fractional CO2 laser, or even what's called a long pulse fractional erbium laser, which can be equivalent for all intents and purposes like a CO2 laser. We offer those things to our patients. We also offer Nd:YAG non-ablative technology for dermal remodeling. So what are the advantages and disadvantages? Well, with a fractional laser technology, you will heal faster, but you may not get the same result as an ablative technology. With a non-ablative technology, there's no real downtime, but it does take some consistency in order to see if you can achieve the best result. We sometimes often combine these technologies with regenerative technology, such as the use of platelet-rich plasma. So platelet-rich plasma helps to induce collagen, induce vascularity, improve skin quality, and wrinkles. So in a way, it's almost like it's a painter having a lot of different paints. We have a lot of tools in our disposal. In our practice, we have everything. So as a surgeon, and I'm able to offer non-surgical solutions, I don't really have a bias, but I do try to figure out what each patient can tolerate and what their expectations are. It's so important to have a good, thorough consultation to get these expectations understood as well as the process understood. A lot of times people bounce around from doctor to doctor. Sometimes they shop price because they learn about a technology, and then some doctor somewhere offers a deep discount to bring people in the door, but then they get disappointed because they didn't get the results they wanted. So it's very important to have a real connection with a good doctor you feel comfortable with, who can offer you a wide array of solutions, and feel comfortable with that doctor's experience and knowledge and understanding of what is achievable. It's very important, because if you don't get what you want, then you'll be out the cost and the time, and you will be dissatisfied. So meet with doctors, and maybe it's necessary for you to travel outside of your area in order to feel comfortable. But learn about these options. Everything has pluses and minuses. There's no one perfect solution. If there was one perfect solution, we'd all use that one perfect solution. This is an art, especially cosmetic dermatology. It's very much an art. And figuring out not only what's optimal from the initial impression, but seeing how you do with the treatment and how you are managed. So I hope that was helpful. I wish you the best of luck. And thank you for your question.